Hi, my name is Libby and I'm a physician assistant student at Duquesne University and I'm going to be doing your procedure today. Before we begin, can I please confirm your name and date of birth?
Yes, Amanda Corsi, 21498.
Great. So Amanda, we're going to be performing a procedure today called a nasogastric tube. And what this is I'm going to be inserting a tube through your nose, down your throat, and into your stomach. And this is going to help to take out some of the fluid that's in your stomach, which will helpfully help with the discomfort. Okay?
Yep.
Before we begin, do you have any history of nasal injury or seizures?
Nope.
Great. Do you have any allergies specifically to adhesives?
Nope.
Do you take any medications?
Nope.
Do you have any question about the procedure?
Nah, let's get to it.
Great. I'd also like you to meet my assistant, Wayne. He will be assisting me with the insertion of the tube. All right?
This is Waldo.
Waldo. I apologize. He's a new addition to the family, to the team here at our apartment hospital. So you ready to get started?
Yes.
Consent. So first, going to get my tape ready. Wash my hands. It's not my day. All right. So first I have to measure the tube to make sure that I have the right length for it to go through her nose down to her stomach. So starting at the nose to the ear, and then from the ear down to the xiphoid process. Trying to keep it as clean as I can, it doesn't have to be sterile. Next, I can cover my patient, you can both your hands up, and give her an emesis basin, just in case anything she were to need to vomit. I would be wearing safety goggles for this procedure. These are a little bit dirty, so I'm not going to wear them for the sake of the video. Have all my supplies. So before I begin, I just need to make sure that your nostrils are clear for us to insert this. So look with my pen light. Next, I'm going to wrap the tube so that it gets a nice little bend in it to follow the shape of her anatomy. And I can attach lube to the first 2 to 3 inches of my nasogastric tube. So I'm going to ask you to participate a little bit in this procedure. This is going to include taking some big sniffs through your nose to help me get the tube down into your throat, and then I'm going to ask you to take some small sips of water for me when we get past that point, all right?
All right.
This might be a little bit uncomfortable to insert, but once it's in, you should feel nothing, okay? So, starting over here, taking some big sniffs in, sniff, sniff, sniff. Great. Once I hit the back of the pharynx, I can have you start taking some sips of water and bend your neck forward for me, inserting it all the way in. That's great. Such a helpful patient. Attach the tube to her nose, and I would wrap the tape around the tube, assuring that there is no torsion or kinks in it, so that everything can be suctioned out. I can also use my syringe and attach it to the nasogastric tube so I could take a sample if I needed it. I could also attach that part to suction in order to take the fluid out of her stomach. She would be sent to chest x-ray immediately to make sure that the tube has been inserted in the correct spot. Now, while you have this in, there's nothing that you can take by mouth. That's so no drinking, no eating while you have this inserted, all right?
Okay.
Great. So now to take the tube out, I would first turn off all suction and detach this from her gown and her bed if there's anything on that. I would cover her again with the towel, make sure that I have my tissues and gauze nearby. I would also check her for any peristalsis so that if there were visible peristalsis on her abdomen, there would still be an ileus present, and we would probably not want to take it out at this point. I can also flush it with 20 cc's of water so that there's no gastric acid coming out of her nose, which would be uncomfortable for the patient. So I have this basin here in case you need to vomit while we're taking this out. And I just want you to take a big deep breath in and a big deep breath out. Pulling this out, this will go into biohazard. My gloves will go into biohazard in case there happens to be any blood on it. And now you need to stay on a soft food diet for the next 12 to 24 hours just to make sure that everything is all set now that we've taken that out. But you did a great job today.